Welcome, and maybe we'll have one or two others that come in today. This is our first time to do something with folks here, and I'm so sorry we don't have a good-sized group for all of you who came and did that. It was so good of you to come, and we're disappointed that the weather did not cooperate with us. If it had been wet, we would have canceled, but it was just cold, and so we thought, nah, we'll try it. But obviously, it's a difficult time for some of our, especially for some of our older folks to get out. It's just awfully cold. My name is Linda Abel, if I haven't had a chance to greet you yet, and I'm a member here at First Church, and we're excited to be doing this Dementia Education and Support series. We have some information on your table, a few things that I want to go over with you to make sure to call your attention to. I just mentioned that we have this Dementia Education and Support series, so there's some little white cards that if you are interested in, at any point in time, in making a donation to that specific fund at the church, we would always appreciate donations for that. It would specifically go to this particular program series that we're doing. A couple other things that I want to call your attention on the piano up here. There are some books that are from the state. It's from Own Your Future, Texas. It's a long-term care planning booklet, and these are available from ownyourfuturetexas.org, but I picked up a bunch at a geriatric symposium not too long ago, so I brought some of these. So you're welcome to take one of these if this is a topic that you're interested in. It does have some very good information about long-term planning, thinking ahead about what we need. Our next session is going to be on February the 8th, and that's this short piece of paper that you have, half sheet. Our topic is, let me see, what did we call it? We put a little title on it, Relationships, Sexuality, and Dementia. What we're going to talk about is what happens with dementia and what happens with the relationships that occur, especially between husband and wife, and what happens when he doesn't know who I am or she doesn't know who I am, or she's living in a residential care community and she has a girlfriend or he has a boyfriend, and I'm still here. And even before that, we're still living at home, and how does dementia affect sexuality? So I think it's a very, very important topic. Those of our friends who are here that are residential care providers will tell you that it is a very important topic that really affects residential care providers. Last year at the Texas Assisted Living Association conference, one of the sessions that we had for our nurses was on dementia and sexuality, because it's a really hot topic, I'll put it that way. So we hope that you'll come for that. So that's one thing. Then we are super excited to tell you about this one. This is Dementia Friendly Fort Worth. We have the privilege of leading the city and the surrounding area in becoming more dementia friendly. We're very excited that the church is kind of the convening group to get this started. And so on January 27th, which is a Saturday morning at 9 o'clock, we are hoping to fill this room with people from all over Fort Worth and the surrounding areas to talk about how can we as a community become more dementia friendly. This is a part of a large national initiative called Dementia Friendly America, and it will take what is called an all sectors approach. That means it will look at all sectors of the community. Healthcare, obviously, residential care, obviously, but things like banks and financial planning and legal planning, businesses, restaurants, retail, transportation, emergency services, government services, looking at government transportation, parks and recreation, public spaces. I mean, every sector of life in Fort Worth is invited to participate in this. And one of the groups that I have learned that we need to target, that I live in Fairmount, and we have a very active neighborhood association, and I send my check in every year. We've lived there for 13 years now, and I have sent my check in every year, and I've never been to a meeting. And that's a shame on me, because now I know how important our neighborhood associations are, because we're going to invite our neighborhood associations to be involved in dementia friendly, because many people, in fact, the majority of people think that most people with dementia live in a memory care, nursing home, or an assisted living community. And that's really not the case. They live down the street from you. They're your neighbors. They live at home. And so we as neighbors need to learn how to be dementia friendly. So this is a really exciting thing. I hope you'll come on January 27th. Bring your neighbors and friends and family and tell everybody about this. And we have more of these if you want to share them with people. So that's exciting. And then as a part of dementia friendly Fort Worth and surrounding areas, We have a program of training. On February 22nd, we have a special speaker coming from Florida. She's a part of Teepa Snow's organization, and Teepa Snow's organization is called Positive Approach to Care. She's a leading dementia educator. She was at the Staten just recently, in fact, just last week, and a few of us had a chance to go and hear her again. An amazing trainer. We have used some of her videos in our sessions, our education sessions. We have the majority of her videos in our church library, and they're available for you to check out and use those for education. We have one of her team members coming on February 22nd. In the morning, she will address how can we become dementia-friendly communities of faith. Because if we're honest, those of us who are members of communities of faith will say, we are not very dementia-friendly. In the first place, we don't know a lot about it. And in the second place, we don't know how to relate to people who have dementia. And sometimes, their behavior kind of gets in the way, and then we're not sure we want them to come. And, and again, that's a shame on us. We can learn how to be dementia-friendly in our communities of faith. So the morning session from 9 to 12 is going to tackle how can we become dementia-friendly communities of faith. The afternoon session is going to tackle how can we become dementia-friendly neighborhoods and caring communities. So again, this is for people that live in a neighborhood. That would be all of us. It's for our neighborhood associations, and it's also for our residential care communities, especially those, of course, that are not certified for memory care. Some of you may be surprised to learn that not all of our assisted living communities that are not memory care certified do a really good job in training their care staff. I can speak to that because that's where I worked for 20 years. So we're going to talk to those folks and say, how can we help you become better at caring for your residents who have dementia? Even though you're not memory care, every assisted living community in the state of Texas has people with dementia. Even the ones that are not memory care certified. And so we really need to learn. So that's on February 22nd. We hope that you will let people know about this. Let your churches know, your communities of faith know, and bring your neighbors. Let your neighborhood association know about this. We're going to try to get the word out to the associations, but we hope that you will come to this session. Okay, I think that's all of the sponsored by, no, our announcements that we wanted to talk to you about today. So those are on your table. If you need more flyers, we will be glad to make those available to you. After the session, and I will try to, not talk forever. I have a tendency to be a little long-winded. Some of you know that. But I will try not to do that so that you have some time. We would like for you to be able to visit with the people who are here. These are folks that, from our experience, deliver good care in home care and in residential care settings. So we hope that you'll have the opportunity to visit with them. We tried to tell folks earlier in the week, especially on Sunday, that this is really for people whether you have dementia or not, or whether that's a concern for you or not, because all of us need to have a plan. All of us need to think about what would I like to have for me in terms of care as I age, or for my loved one, and where would I like to live if I can't live at home? And all of us need to be thinking about that, because things can happen overnight that change what we think we would do. And so some of us have been in that situation with our families. I certainly have. And so my husband and I, even though we're not ready to even think about home care or where we might live down the road, are already thinking about where could we live, what could we afford, because, there are different prices, and who provides the services that we think we might need, and that sort of thing, so that if something happened to one of us overnight, our sons would be able to help the other one in making that decision. So this is really for everybody today as we age. So our topic today is, what if my family can't take care of me? So as I mentioned earlier, the majority of people with dementia and other healthcare needs, as you know, live at home. We do not live in nursing care facilities or in assisted living or memory care communities. But all of us need to think about where would we live. So we often fail to discuss this in advance, and so our family members are left having to plan. So the idea of this is to think about, where would I be able to place my loved one? Some of you are in the situation of having to think about that. It could happen relatively soon, and some of us are thinking down the road. That's why this might be helpful to some of you, okay? So some of the things that we need to do are, if we are married, or if we are the child of older parents and we are considering what might we do to provide good care for our parents, we need to talk about it. And that's one of the things that we're not very good about. We need to have discussions about what we would like. And there are some ways that we can do this. The book helps. There are a couple of websites that might be helpful to you. One is about Care Conversations, careconversations.org, and they help you know how to talk about it. They've got a lot of great resources on there. And there are some other things that, if this is something that you need, if you'll see us, we'll help connect you with some of those things. But asking some questions while we are still able to ask questions, having those discussions while we're still able to have those questions, because we know that as our health changes and as the dementia progresses, we may not be able to have those questions. So what are some of the things that you might want to discuss in that conversation? Do we have advance directives? Because if we don't, boy, now is the time. Everyone in this room, all of us, regardless of our age, should have advance directives. What will happen if I can't tell you what I want in the way of care? Who will make that decision for me, and how will they know what I want if I don't talk to somebody about it and write it down? So do we have advance directives? And there are a number of different types of advance directives. We had a workshop on that. I'm sure we'll do that again. Excuse me. I'm sure we'll do one of those later, but there's lots of material on that. So if that's information that you need, please see us. Probably most of these providers can also help you with that. What resources do we have available? I mentioned, what can we afford? My husband and I, what can we afford? There are services that are available in a wide variety of costs, and so we need to know what are the resources that we have. And in some families, only one person has done all the financial stuff, and the other person doesn't know anything. When my father-in-law died, my mother-in-law had no clue about anything about their finances. She did not know anything about paying their bills. She knew nothing about their insurance. She knew nothing. Now, she was very fortunate that my sister-in-law is a CPA. So she was able to go through my father-in-law's stuff and figure out stuff. But sometimes the poor spouse is there and has no clue. And so we need to talk about that now and make sure that people know, that our children know, where do you bank? Or sometimes our kids don't even know where our bank is, and just simple things like that. So what are our resources, and how would our spouse or our children or our neighbor or whoever is going to be helping us, how would they know what our resources are? And we need to look at what can we afford, and then we need to visit places and talk to in-home providers, and how do we fund that? And we're going to talk about some of that stuff in a few minutes. Does everybody in our family know who our physician is? And have we, made sure that our physician knows who our family member is? Do they have a copy of our advance directives if we have one of those? So a lot of things that we need to talk about that. Where do we keep all that paperwork that we put together? A lot of people say they have advance directives, and you know where they are? They're in the safe deposit box at the bank. That's the last place you want them. Nobody can get them, if something happens. So we need to think about those things. If we can't live at home, where would you like to live in terms of what kind of place? That sort of thing. So these are some of the questions that we need to have discussions about, and they're not easy questions to talk about, because in this country, we live and act as though we're going to live forever. We just do. And we're afraid to talk about death. It's not a comfortable subject. So we need to talk about, as my health fails, what happens. Because eventually, everyone in this room is going to get old and die. And all of us, I think, would like to get older and older before we die. So we need to think about this and have these conversations. So we need to talk about that. And then also one of the things that we can talk about when we start thinking about what will we do for care is, how can I help whoever is going to care for my loved one, wherever they are going to do it? How will they know who my loved one is? How will they know who I am if I live by myself and I'm starting to need care and making these decisions? So taking the opportunity to have discussions about our life story, this is really important. And we did a session once here on recording your story so that your family knows. Take advantage of the times when family members are together to ask questions and get out your smartphone and record it, that sort of thing. And there's some other programs and companies, and again, if this is something you want some more information about, we can help you with that. But recording our story is really important for our family, but it's really important for the people who may take care of us, because they need to know who we are. So those are some of the things that we can talk about as we consider what we're going to do in terms of when we need care, when our loved one needs care. So let's talk about what are some of the options. Okay, so I'm just going to run through some real quickly, and then we'll dive into a couple of them more deeply. So one option for care is adult daycare. There are adult daycare centers around the community where if our family member, for example, still works or, has young children or, just really is very, very busy and cannot be with us, but or they just need a break. We love people, but sometimes there's just a little too much togetherness. Ask people who work with their spouse. They'll tell you that sometimes there's just a little too much togetherness. So sometimes, even though we love our family dearly, we need a break. And so there are adult daycare centers. So that may be something that we want to look into. Respite care is something that can also help the person who is caring for anyone with a health issue or with dementia. Some of the communities that are here provide respite care. That's where you might go, your loved one might go into a residential care community for a weekend or a week. What do you do if you have to travel out of town to your grandson's wedding and your loved one really can't travel with you? How do you handle that? So respite care is one option for care that may be something that we do one time, but it may be something that we do on an ongoing basis once a month. The caregiver gets a break or whatever. So respite care, and it can be moving into or going to stay in, kind of like a hotel room in a care community. It could be arranging for family members to come and give you a break. But all of that is called respite care. Then we have in-home care, which we're going to talk about in depth in a little bit, so I won't go into a whole lot of information about that right now. But those are the folks who come into your home and help provide some care. And it can be health care, but it can also be just care in terms of activities of daily living, bathing, dressing, preparing meals and those kinds of things. So that's an option. Assisted living is an option, of course. We'll go into some detail about that. Most people don't really understand a lot about assisted living, and I will tell you right now that most of your physicians do not understand assisted living and what can and cannot be provided there. And so we're always having to educate our physicians. So it's something that you need to be educated about, and you really need to visit some places, and we'll talk some more about that later. And then, of course, skilled nursing care is an option for care. And most of us, would say that that's really kind of our last option. We really don't want to go into the home. If you're like my grandparents, they don't want to live in the home. But, my grandparents ended up living in one and loved it and extended their life for years. So it just, depends. And so that may be something that we all also need to think about. And we also need to think about if that is where we're going to end up, how do we pay for that? Huge misconception is that Medicare pays for long-term care, and it does not. Pays for short-term stays in a skilled nursing facility, but it doesn't pay for long-term care. So we need to think about that. And we can talk some more about that, maybe answer some questions about that. So that's another option for care. And then, of course, there's specific dementia care. Assisted living can be what I call a regular assisted living, but it can also be assisted living that is certified for dementia care. A nursing home may do dementia care. James L. West, right down the street from us, is an absolutely outstanding nursing home that provides dementia care. That's all they do. And if you've not visited there, you really ought to go. I will tell you that I went. They're in the back, and you can visit with them. My image, I will just fess up, my image of a nursing home that just does memory care is that everybody there would be in very late stages of dementia. And I was very surprised that's not true. And so, it's something you need to look at. It's one option. And so dementia care or specialized care, whether it's assisted living or residential care in a nursing home. There are also some home care agencies that provide specialized training for their care providers that come into the home and can help with dementia care. And so some of these are the folks that do that. Not every home care agency trains their people to work with people with dementia. We just have to be honest about that. And not every assisted living community trains their people well. So we hope that you'll visit with these folks that can provide some good care. And then, of course, another option for care, depending on where we have lived and where we are living, is hospice care. Actually, it doesn't depend on that. You can get hospice care wherever you live. Hospice care is a Medicare benefit to which everyone is entitled as you age. And one of the problems that many people have with hospice care is when anybody says, I think we ought to consider hospice, they hear, you're giving up. And that's not true. Hospice care provides the support that the family needs, but they also provide the kind of care that the person who has a terminal disease. It doesn't mean we expect you to die tomorrow or next week. Hospice care, in order to be on hospice, you have to be certified to have a terminal diagnosis that might result in death within 6 months. So we are not saying that we think you're going to die next week. But by going on hospice earlier rather than later, you can take advantage of all of the support services that hospice has available, and that is a tremendous service. So we really need to broaden our perspective as it relates to hospice, and it's always better to receive hospice care earlier rather than later. So that's another option for care. Whether you are in your own home or you are in a residential care community, you are entitled to hospice care. And then one thing that doesn't really talk about where you get care, but talks about how you might fund care, that I just want to make sure that every veteran, spouse, or widow of a veteran is aware of. And that is that if a person has served at least 1 day on active duty during a declared wartime, actually not even declared because the Korean War and the Vietnam War were not really so much declared, at least Vietnam was not, but during wartime, 1 day on active duty during wartime, then you may be entitled to a benefit from the Veterans Administration called aid and attendance. And this benefit is really substantial and it can be used in your own home, but it can also be used if the decision is made that residential care is the best place. And it can make the difference in whether or not you can afford it or not. And so if that description of you or your spouse is relevant to you, then that's something that you should ask about. You can ask these folks, because probably everyone in this room knows about that and does screen their potential clients or residents for that. You can also get information from the state, and you can get information from the VA and your local VFW. Usually they have some information about that too. It's called aid and attendance, and it's a substantial benefit. Somebody help me. It's around $1,700 a month. The new for this year, so how much is it?
The veteran can get $1,823 a month, up to that. Surviving spouse can get up to about $1,200, over $1,200 now. I think together they can get around $2,400 a month.
So you can see that would make a huge difference in your ability to afford some care. And so it's something that you really ought to think about. There are financial considerations, but there are also companies that can help you, kind of, I don't like the word manipulate because it sounds like it's something sneaky and illegal, but it's not. But there are ways that can help you plan your finances to do that. Yes?
So the good thing about that, unlike Medicaid, the VA does not look back.
Yes.
So if there is asset problems, you can move those assets into VA-compliant annuities, which become a revenue stream, which will be very important later on down the road. And there are people who will do that and get that all set up.
And again, there are companies that will do that, and so you can ask about that. It really is an important asset and can literally make the difference in what you can and cannot afford. I mean, it's really, really important that veterans and their surviving spouses and all that. So that's something you want to think about. Okay, so let's talk just a little bit about home care. So if your choice is to stay at home, and if you ask most people, where would you like to be cared for as you get older, most people are going to say, I want to stay in my home. But we need to think about it and plan for it. It's not going to happen if we don't think about it wisely. And so let's talk a little bit about home care. So you need to know that in Texas, home and community support service agencies are licensed by Texas Health and Human Services. Those are the people that can provide care in the home. And there are also licensed home health agencies that can provide services billed to Medicare. They are both licensed and certified, and others are just licensed. And so there's a variety of types of care, so we'll talk a little bit about that also in a moment. But they all have to be licensed, so you have to know that, okay? So who might want to use home care? On an acute basis, I've been ill and I've been in the hospital, that sort of thing. People who are coming home from the hospital, home care is a really good option for you if you don't want to go rehab in a skilled rehab facility, if your physician feels that this would be work for you. But people who are not fully recovered, maybe I don't really need rehab, but I've been sick for 2 weeks and I just don't have my strength, and maybe I live with my wife, and maybe my wife is not able to help me, in and out of the shower or the bathtub or whatever. I mean, people who have been discharged but are not quite back up to 100% strength. People who have chronic conditions benefit well from a home care. And not just things like dementia, but things like heart disease, diabetes, respiratory diseases like chronic obstructive pulmonary disease. Those are people that can use home care. People with limited mobility that still want to live in their home, that may be something that may be helpful for you. And then, of course, families who need respite. We talked a little bit about that. So why might you want to use home care in addition to the kinds of people that might use it? One important reason is that obviously it's one-to-one care. It's very personalized. It's one-on-one. They come to your home. You don't have to go anywhere to get the care. And so it allows you the maximum amount of choice, the maximum amount of attention from the care provider, that sort of thing. It may be less expensive than other types of care, some sort of residential care. It depends on what kinds of services you're going to need and what the funding source is. And again, we'll mention that, and you can talk to these folks about that. Medicare will pay for some in-home care, but you have to meet certain criteria. And then there, of course, is private care that you can pay for. So it might help with family resources. It might be less expensive than residential care, and Medicare might fund some of that for you. And, of course, it allows people to be, I still live at home. I get to live in my home. I get to see my dog every day. Although you need to know that many residential care communities also allow pets. But you just get to live in your home. So what are some of the types of home care? There's, as I mentioned, licensed and certified home health care. These people are licensed by the state of Texas, and they are certified to bill Medicare, which means that you can use Medicare benefits if you are eligible for those. And they provide all kinds of skilled services: skilled nursing, speech-language pathology or speech therapist, physical therapy, occupational therapy, social work. They have social workers that are available to help you look at other sources of providing care for you that can help you determine whether or not you could benefit from service from a particular agency, or if you qualify for this or that or the other. So they can help you arrange for any kind of durable medical equipment, help you find wheelchairs and lifts and side rails on beds and all that kind of stuff. So they can help you with those kinds of things. Social workers are very helpful in that. And then, of course, they have home health aides that can provide services in terms of helping with bathing, dressing, grooming, toileting, those kinds of things. In order to have a home health aide provided by a licensed and certified home health agency that is going to bill Medicare, you must require a skilled service. So in other words, you cannot just get a Medicare home health agency to come and provide a home health aide for you if you don't need some other kind of care like nursing or therapy, the things that we talk about. That's part of the qualifications. But they do have those available. So that's a licensed and certified agency. Then there are licensed home health agencies that are not Medicare certified, and that means they do not bill Medicare. They might bill private insurance, but they do not bill Medicare. They also can provide skilled nursing and just care services that would not be billed, care services that you don't have to have a skilled care for. You can have a home health aide, someone to cook meals, for example, or to help you with laundry, or sometimes even do housekeeping or whatever, or be with you for an extended period of time. One of the disadvantages to home health care is that it's a short window of time. They're there for maybe an hour. But in private home care, you may have them there for 4 hours, 8 hours, whatever. So there are options there, and you'll want to visit with folks about that. And then one of the things that you need to know about providing or selecting an agency is, how do they bill? How do they train their staff? I just can't stress that enough for both residential care and in-home care. What it comes down to is quality care, if you're going to get it, is going to be provided by people who've been trained to deliver quality care. And you want to make sure that that's really happening, because a lot of no offense, folks, but the brochures look great, but you want to know how they train their staff, because that's really who's going to be taking care of you or your loved one. It's the caregiver. Nurses are not going to be providing much care for you. Let's be honest. It's going to be the caregivers. So how do they train their staff? And that's a very important question to ask. Are they a member of an agency, a state agency? Or if they're licensed, they should be licensed. How are they doing on their surveys? You can ask for their survey history. If it's a licensed agency, you should be able to get that through the state of Texas, but only a limited amount of information. So you can ask to see their survey history. So a lot of things like that. Are they a member of a national agency like or a state agency? Organization like the Texas Association, Home Care Association. So you want to ask some questions like that when you are interviewing or thinking about looking at home care. Another thing to think about if you're considering home care then is, depending on what's wrong with the person that needs home care, is your home set up properly? So let's talk for a few moments about making your home dementia friendly, because that's really important, and as the disease progresses, it becomes more and more important that your home is dementia friendly. So here are some tips for just any room, and then we'll kind of real quickly talk about some tips for just several of the rooms that are real important. One thing is we want to leave the windows open and let natural light in. One of the problems that people with dementia have often is their circadian rhythms, their sleep-wake cycles get messed up. Really important that we know that it's daylight outside. So we want to make sure that we open our blinds and open the windows and let good light in so that it helps. And then at night we want to close them, because sometimes we have reflections and you can see your own reflection in the window, and that can be very confusing. It can be as confusing as seeing your reflection in a mirror. And for some people, we need to cover the mirrors because it's very confusing to them. So we need to think about as the disease progresses. Trip hazards are really important as we age, but especially for people with dementia. So do we have really pretty throw rugs down? Are they taped down so they don't, we don't catch a toe on them and it flops it up and we trip and things like that? So looking at trip hazards in the room, looking at wires, cables, extension cords, and things like that, those are important. I talked about mirrors, phone numbers, making sure that if the person is still wanting to use the phone, have you seen those phones that have pictures on them? They have great big buttons, and then you can actually put a picture because you can put speed dial. And so instead of having to know the number one, if I recognize my daughter, I can push the button and it calls my daughter. Things like that. So helping them to be able to use the phone if that is where they are in the disease process. There comes a time when you may not want them to be able to use the phone because they may be calling you at all hours of the day and night. Looking at the patterns, this might be really confusing in a home because there are so many patterns that might confuse people. Making our floors easier to navigate. Sometimes you'll see a person with dementia who gets to a change in the carpet and they will stop and they will not be sure if they really should take another step because their vision is affected and their depth perception is affected. So we really need to watch out for how's our flooring and can we make it easier for our folks. How about on steps? Can we put some tape that actually outlines the step for them? Because if you've got 3 concrete steps up to your front porch, they're all the same color. How do you help them know which is step 1, step 2, step 3? So little things like that. Putting little labels, sticky notes, pictures, anything like that that helps them know what's in a drawer and what's in a cabinet. That may be helpful to them. Having designated places where everybody puts their keys there. We know this is where we drop the keys, or whatever it is that we want to always have available. Setting your hot water heater so that it never gets above 120, because sometimes they may forget how to turn the water off. As you visit residential care communities, many of them do not have showers in the apartments for memory care. They go to I hate to call them shower rooms, a spa room is what many of them call them, where they have individual tubs and showers for people to get clean, because people sometimes don't know how to regulate the water temperature. And if you don't want to turn the water off, those things like you use for toddlers where they can't open doors, maybe you can get something like that. I mean, we just have to think about those things. If you're thinking about safety and you want to stay at home, you got to be safe. These agencies can help you look at your home and see if it's safe. All right, real quick, just a few other, keep household cleaners locked up. Those little things that you use when you have toddlers on the cabinets, baby-proof your house. Really good, because as dementia progresses, people can mistake household cleaners for something to drink, and none of us want to go down that road. So we need to look at that. And every good residential care community will have housekeeping carts with locked cabinets. And if you're touring, you should never see a housekeeping cart with an unlocked cabinet, and you should not see housekeeping cleaners on top of the cart. That's a big big no-no, and the state would fuss at them if they saw it. I would fuss if I toured when I was doing audits of communities. That's just something to look for because it's very, very dangerous. In your home, you have to think about that. All right, in the living room, we already talked about lighting. Make sure you have seating that's comfortable. How easy is it for them to get up and down? You know, chairs like this would be really much easier than soft things that you sink down into. So we might need to get a new chair. We might need to think about where are they going to sit. If your remote control to the TV is like a lot of them, it's tiny, tiny lettering. I mean, ours is about, you know, maybe this big, but they make them that are giant size with big. If they're still able to navigate the remote, you might want to make it easier for them and maybe put tape over some of the buttons that are really irrelevant to them or that they shouldn't press because it can create problems for them. So looking at your remote. Make sure that you have pictures and things that are very familiar where they can see it. Up on a wall is not really a good place. Remember that vision changes as dementia progresses, so make it where they can see it so that you can talk about, you know, look at the picture of John. Gosh, that was taken 2 years ago. Hasn't he grown? Or things like that. Make sure that they have familiar pictures, memorabilia that is at an eye level and in a place that they can see well. In the kitchen, try to keep your countertops. My kitchen is definitely not dementia friendly right now. Keep your countertops as free of clutter as possible because we want to make sure that they're safe. Using placemats that are a different color than your dinnerware. That can be helpful. Again, visual changes occur. Using bright colors can be very helpful, so that may be something that you want to think about. Also, again, your home care agencies here can really help you with this. There are all kinds of gadgets now that make it so much easier for people to manipulate utensils. They're big handles so that it's easier to hold on to. Some of them are right angles, so you don't have to go like this. You can just go like this, you know, to put food in your mouth. There are cups that have a nose piece so that if my neck doesn't, you know, bend well because I have really bad arthritis, I don't have to lean back so far because I can tilt the cup farther because my nose has a place to go. I mean, there's just all kinds of stuff like that that can make it easier on everybody for you or your family member to live at home. And there are so many more gadgets and things available for us now than were available years ago, so you want to think about that. Bedroom. You know those lamps that you just touch to turn on? That can be much easier for a person with dementia. Getting your hand up under the lampshade and turning those, how hard are they for us? You might want something where they can turn the lamp on easier. Just simple little things can make their life so much better. If it's possible, you can make sure that they can see into the bathroom at night because it makes it easier for them to find the bathroom. I used to travel a lot in my work, and this is, again, confession time, but, you know, I might be in 2 or 3 different hotels, and I sometimes would wake up in the middle of the night because I'm old and I had to go to the bathroom a lot, and I would wake up in the middle of the night, and I don't remember if I'm turning right or left to go to the bathroom. You know, if you get dementia, you may not always remember, is it to the right or to the left, but if I can see the bathroom. So if it's possible to arrange furniture where they can see, that may be helpful. You know, it may be helpful to put a picture of a toilet on the bathroom door because sometimes that's an issue. I don't know which door it is. I know it's behind a door, but I don't know which door. And you'd be surprised how many people go to the closet, and then we have problems. So just simple little things like that. If someone is getting up a lot during the night and you really want to be aware of when they're getting up, maybe help them to the bathroom. There are sensors that can alert you that they're getting up out of the bed, those kinds of things, getting up from chairs. That sort of thing. This may be the time that you want to make it where your bathroom doors don't lock from the inside because you know they might lock the door unintentionally and not know how to get out. Those kinds of things, just things to think about. If your basin is white and your counter is white, you might want to put some stickers or some kind of tape around the basins. Basin, I guess that's what you call it, isn't it? So that they can see where does the countertop end and where does the bowl begin. That sort of thing. So there's some things there that you might think about. Make sure that you have non-slip strips or mats or whatever in the shower. Do you need equipment like shower chairs? That sort of thing. Just things to think about. And then in the outdoors, it's really important that people go outdoors, not on a day like today, of course, unless you bundle up really well. But going outside is really important. Getting some sunshine is really important. So we want to make sure that we have safe places. So is your yard fenced? Is your backyard fenced? Is there any way you could at least fence off a small portion where people could go out and be safe? Do you have locks on your gate so that if they go outside, they would be safe? They can't, leave the yard. All of your memory care communities will have outdoor spaces where people can go outside but cannot leave the perimeter. All memory care, if they're certified for memory care, they're going to have that available. So those are just some things that you might want to think about. Okay, I know that was really fast, but again, you have the opportunity to talk to some good in-home care providers, okay? Now, what happens if in-home care is not enough? What if you decide, if you reach the point where it's just not working? Why might it not be working? Well, for one thing, let's just be honest. Some of us are designed, our personalities, our skills, our traits, our just who we are, we're great caregivers. And some of us are not. And that's not a value statement. That's just a who we are statement. We're all different. One of the most important things that we can talk about is if I can't take care of you, or if you can't take care of me, it's okay to place me somewhere where they can. We need to say that. And making somebody promise that they'll never move you out of your home is a really sad thing to do. Nobody can really promise that. We just don't know. So we need to think about where might we go if we can't provide the care. I'll just be honest with you, and I'm a nurse, folks. I'm not the best at providing care. I mean, I can care when my husband's sick or when he's had his knees replaced or his shoulder replaced or, all that stuff. I'm pretty good for a few days, but my compassion quotient goes down real quickly, as I try to take care of him. So, we're already having those discussions. I don't expect either one of us to be the caregiver. There comes a point where sometime we have to say, I need to be the wife, not the caregiver. And some of you might want to visit with Gail. She has a great story about a daughter who needed to hear that and what a difference it made in her life. So, that being said, there may come a time when even with some outside support and help, it may not be working. It just may not be working anymore. So we need to think about where might we want to place our person or have ourselves go. So what are some of the signs that we might need some additional help? Here are some questions to ask. As a caregiver, I'm going to ask it as are you, but this could be, for anybody. So are you angry that the things are the way they are? Most of us might be. Are you anxious about facing another day? Is it like, I just don't know if I can do this for another day? Have you reached that point? Are you defensive about your loved one's condition and its effect on others? Are you embarrassed by their behavior? Are you exhausted? And many caregivers will tell you they are exhausted. And you also need to be aware, unfortunately, the fact is that many caregivers will die before the person who has the chronic disease, including dementia, dies because they have destroyed their health in the process. So we need to be honest about that. Are you exhausted because of the ever-present concerns and sleepless nights? Are you frustrated that you can't do more and that you're missing out on life? Because frustration can turn into resentment. And resentment can turn into anger focused at the person. And unfortunately, the fact is that having dementia increases your risk of being or experiencing abuse. Not that we intended to do it in the first place, but there comes a point when sometimes it just happens, unfortunately. Are you ill, either physically or mentally? Is it just affecting your own mental health, or maybe even both? With questions a caregiver can ask. Are you irritable because nothing seems to be going right? Are you just irritable all the time? Are you rushed because you don't have as much time as you would like to, or do you feel like you never have any time for yourself? Are you sad all the time? Depression is a huge risk for caregivers. And are you uncomfortable? Some of us are just not built to be caregivers. We're just not wired that way. And it's not good or bad, it's just who we are. Give ourselves permission to be honest about who we are. And then, of course, what if your health is at risk? If you've got chronic health issues or you see your health deteriorating, you really need to think about what kind of help do I need? Is it in-home or have we gone way beyond that? I'm at the point where I can't even do that anymore. For some people, that does happen. So there are some books that can help you. There are some tools that can help you looking at where are we and where should we go? And if you need some help with that, we can give you some guidance on that. If you go to elderindustry.com, there are some great resources there that can help you look at planning and discussing and having those care conversations, which can be uncomfortable, but they're so, so important. Okay? All right, so very briefly, assisted living and memory care. Assisted living or memory care or other residential care, such as James L. West, which is not assisted living, but it's memory care. So there, you've got options. Regular assisted living that is certified for memory care, and nursing homes that only do memory care. So you need, there are all of those. All of those are licensed by the state of Texas. The Health and Human Services Commission licenses all residential providers that have 4 or more people. So if you're looking at a small home, if they have 4 or more people and one of them is not related to the person that owns it, you need to ask to see the license. Because if they have 4 or more unrelated to the person that owns the home, then they're supposed to have a license. And if they don't, that means nobody's coming to look. And that's a scary thought. Nobody's surveying them. Licenses for assisted living, I'm going to speak more about that than nursing homes, because I really don't know as much about nursing homes, but I do think you need to go look at James L. West. It's a great place. Assisted living in Texas, there are 2 types of license. There is a type A and a type B. If you are looking at someone with dementia and you're maybe going to move them into a regular assisted living and then into memory care, or you're thinking that might need memory care down the road, then you should look at a type B license. A type A license limits the type of care that can be provided. The person has to be ambulatory or independently mobile. They may be in a wheelchair, but they have to be able to self-transfer and evacuate the building on their own. Someone with dementia is going to reach the point where they can. They also have to be able to follow the directions to evacuate in an emergency. And in a type A community, if they cannot, Mrs. Jones, meet us in the living room, that's the fire alarm, I'll meet you there. And if they can't go there on their own without physical assistance from the staff, then they should not be in a type A. So for the most part, I would say to you, you should look at type B communities, and everyone that's here is licensed as a type B, okay? Now, if you are specifically looking for memory care, they must have a type B license, and if they advertise that they are memory care, dementia care, Alzheimer's care, any of those kind of phrases, you should also ask to see their certificate. They will have a license and they will have a certificate that authorizes them to advertise that they are memory care, so you want to know about that. In order to get the license, there are certain requirements, but in order to get the memory care certificate, there are additional requirements, including some specific training requirements regarding dementia. So it's important that you know which kind of license does this person have. And if you need some help knowing that, we can help you navigate the state website if you're going to look at some, or you can just call and ask them, what type of license do you have? And they should be able to tell you it's an A or a B. Are you certified for memory care? And they should be able to tell you that. Services that are provided can vary greatly. Everyone who has a type B license can provide the same services, but every company makes their own decisions. So just because this assisted living memory care provides, does these specific services, doesn't mean that everyone does. Here's an example. At one point, my mother-in-law, we moved her into an assisted living community because of issues that were going on with her. By the way, she had a reversible dementia or pseudo dementia. Hers was caused by a drug toxicity, and it was really amazing to see that she just got dementia overnight. Fortunately, when we got her off the drug, she came back to mostly where she had been, but she was having some other health issues and we really didn't feel safe with her being at home. So we found a really nice community, licensed, belonged to a national company, all that good stuff. One of the services that she needed that I asked them about, they don't provide. The answer I got when I asked about it was, oh, you can't do that in assisted living. Now, I knew better because I teach assisted living managers. The answer was not, you can't do that in assisted living. It was our company policy. So you want to ask, what are their policies? For example, if your mom, I know this is kind of gross, but if your loved one, has some problems with constipation, which a lot of them do, and they need a little enema from time to time, or they need a suppository from time to time, you better find out if that company's policy lets their staff do that if they don't have nurses around the clock. So that brings up another issue. Assisted living communities in Texas are not required to have a nurse. okay? So you need to ask, do you have a nurse? Now, I will tell you that James L. West, Silverado, Riverside, y'all have nurses around the clock? Riverside? Around the clock, okay. Forget who else is here. Bethesda, y'all have nurses around the clock? No, but you have a nurse Monday through Friday, at least 8 hours a day or whatever. Okay, so you just want to know what kind of nursing service do they have, because that may affect whether or not, for example, they would do that suppository. Because if they don't let their staff do it, which is legal in Texas, by the way, I can answer a lot of questions about that stuff that we don't have time to go into. But you want to ask, what kind of nursing coverage do you have? Okay, is a nurse necessary around the clock? You have to make that decision. In memory care, it's nicer. Is it necessary? Again, state of Texas says it's not. Then you have to decide, well, does the state of Texas know what they're doing? And half the time the answer to that is no, but that may not be when it comes to, licensing our community. So that's a decision that you have to make. And you need to look at your person's overall health. If they have a lot of chronic conditions that really might need a nurse, then that might be something you want to look at. In some instances, and it just really varies, so I can't give you a guideline on this. In some instances, they might be able to have an outside provider also help with some care, but in some instances, they may not. Okay, so they may not qualify for that in some residential care communities. So there's some rules about that, and the rules do not belong to the residential care communities. The rules are Medicare rules that will not allow them to provide care in certain places under certain situations. And if that's a question that you have, I'll be glad to address that later on. You should know that every resident has rights, both in nursing homes and assisted living. The state of Texas says that has a resident bill of rights. It will be posted in the community, and if you move someone in, a copy will be given to you. You should also know that there is a provider's bill of rights in assisted living. Is there one in nursing homes? I don't know the answer to that, but there is in assisted living. They are not required to give you a copy of it. If I had my way, they would be required to give you a copy of it. And here's the reason. Sometimes people, I know no one in this room would do this, but there are some family members who are incredibly unreasonable when it comes to what they expect of the assisted living community. I'm just going to be honest with you. Sometimes taking care of your loved one is a piece of cake, but taking care of you is just a royal pain, okay? And sometimes we actually have to go so far as to say, you know what, we have rights too, and you are violating one of our rights, and that is that we have the right to be, every provider has the right to be treated with the respect and dignity as an assisted living agency or provider and the people that work there. That's one of the rights that a provider has. So in other words, it's not okay for family members to yell at the staff. You may have an issue, but you don't do it by yelling and you don't do it by yelling. Again, you guys would not do this, but you would not believe what staff members have to put up with sometimes. So know that there are rights for residents and there are rights for the providers too. And then there are some things that, we can help you with. In fact, we're going to do a session later on about what if my loved one is in community care, how to stay involved and active but get along with the staff. There are some hints that we can give you about that, okay, so that you will be one of their favorite people to see coming, and they will not run when they see you coming. And so we can give you some tips about that too. All right, so what are some signs that your loved one or you might be needing assistance, not because so much of stress, but maybe just some other things that might be going on, and especially and maybe it's a loved one who's living alone, and some of these might relate to you. Feeling they're getting forgetful, they sometimes feel confused or they're lost, they get mixed up, they forget to take their meds. That's a huge issue. It's near the top of the list of the number one reason why people move into assisted living and memory care is because they're forgetting to take their meds. It's also one of the things that home care agencies can provide for you, but that is an issue that you need to be careful and really be monitoring if your person does have health issues and does take medications and you are concerned about them. Are they forgetting to take them? Because that's a big, big deal. They forget to go to the doctor. They overlook some things that are safety issues. They forget to lock the doors at night. They forget to turn the fire off under the pot, and then you come in and the fire alarm went off and the fire department's there and all that, all that kind of stuff. You happen to see the mail on the counter and it's final due notice of something like that because they're forgetting to pay bills. So those are things that you can look at. They're having trouble with money management in terms of writing checks. You need to talk to your bank, see if they can be helpful with you. Dementia Friendly America, one of our sectors that we want to work with are banks. And how can you notice that someone may be at risk of making some really bad financial decisions because there may be dementia involved? And so how can you pick up on that? And what are some safeguards that you can put in place? So those are some things. Does your loved one feel lonely? Are they depressed? Are they frustrated or stressed? Depending on their health issue, if it's dementia, sometimes early on they know there's something going on. They're frightened, they're angry, they're frustrated, and so you may pick up on some of that. Sometimes they're really good at hiding it from us for a long time. Are they starting to withdraw, and they're not as socially active as they used to be? Are you or are they feeling more tired? They don't do anything. They just sit in the chair all day. You can't get them to go with you to anything. They're just kind of socially withdrawing. Have you noticed a change in their eating habits? Are they losing weight? Are their clothes not fitting the way they used to? That's a big sign that we need to intervene and work with them. Do they have trouble with their activities of daily living? Trouble with mobility, walking, getting around on their own? Do they forget to use their walker or their cane? Do they have trouble with bathing, dressing, grooming, and all that kind of stuff? And keeping the house. Mom used to be a meticulous housekeeper, and it's not that way now. They used to be very neat, and now there are piles of stuff. These are signs that we might need to get more involved with this family member, whether it's bringing in some help or thinking about other ways. So a lot of things like that. And then, of course, we talked a little bit about respite care, and that can be done in an assisted living community as well as bringing in someone to provide that. Okay? That gets us through most of what I wanted to talk about in terms of just giving you an overview. Are there some questions that you really would like to ask? And I will try to come to you with the microphone, and if I don't know the answer, which is a good chance I don't, we will let one of our folks that are here maybe try to answer the question for you. Again, my area of expertise is assisted living. Just so you know, about once a month I teach a class for the Texas Assisted Living Association, and I teach assisted living managers and nurses. So if it has to do with assisted living, I've got a fair idea of the answers, but specifics for each company, you'll need to get with them. And what are you going to be, my Vanna? He's going to be Vanna. Isn't that nice? Thank you, Vanna.
Donahue, I go back up.
Okay. And just so you know, this is the Reverend Lynn Deloney, and he is on the staff here at First Church, and he also works with community hospice as a chaplain. So if you've got some questions about hospice and the services, and one of the services they provide is a chaplain. You may have your own pastor, but they have chaplains who will also go visit. And so it's just more support. Okay, so any questions that we might be able to answer for you? Any of you have something that you were wanting to find out about, or something that I asked and I said, we can talk to you later or whatever, maybe we can answer the question for everybody, that sort of thing? Anybody have questions? Yes, ma'am.
The inability to regulate their meds, is that a nursing requirement that can qualify them for placement?
If you're talking about for Medicare to pay for it in a nursing home, no. What you have to have for Medicare to pay for a short-term stay, which is, help me out, 90 days? James L. West? I think it's 90 days. You have to have a 3-day inpatient stay in a hospital before Medicare will pick up to 90 days. I believe it's 90 days. Up to 120. It's what? Yeah, you have to be in the hospital. So and I'm glad you said 3 midnights, but what that means is observation in the ER observation thing does not count as an inpatient day. So you really have to be aware of that. It takes 3 inpatient days, and the day of discharge doesn't count, right? I think that's right. So you really need to be aware of that. Will nursing alone let Medicare pay for it? No. Medication assistance. For home care, help me out, someone with home care. Yes.
Yes, Medicare will allow nurses to come in and do the monitoring, so.
The monitoring, but not the daily administration.
Well, they help set up the box and so forth.
That's a different thing, so, yeah.
Right.
So there are services
They
that
can
can be
come
provided, but
sometimes
going
more
in
often.
every day to make
No.
sure that someone gets a med is not a nurse, service that Medicare will pay for. There are ways for nurses to oversee it if it's a Medicare agency. And the way they do that is to train other unlicensed people, the same way assisted living agencies do it. We train unlicensed people to assist with medications, and so that can be done. But that does not mean that a nurse is going to
That's
come every
not
day
a
and make sure they're gonna take their meds. Good question.
Requirement of medical, okay. Sort of related, I
Mm-hmm.
only talked to one assisted living place, and they were charging extra to,
Good
Finish
question,
out
to
the
do
meds.
meds. Okay, good question. How do assisted living communities charge? There are two different ways. One is what's called all-inclusive. There are a number of memory care communities that are all-inclusive. Bethesda is all-inclusive. Silverado, you're all-inclusive. I forget who else is here, I'm so sorry. Thank you. Oh, Riverside, are you all-inclusive? Okay. It is more common to find all-inclusive care in memory care than it is for regular assisted living. There are some, but not nearly as many in regular assisted living. Typically in assisted living, there is a base rate, and that depends on what kind of apartment you have. If you live in an apartment by yourself, or if you have a roommate, and is it a studio, or is it a studio deluxe, or is it a one-bedroom, or a one-bedroom deluxe, or is it 2 bedrooms? I mean, it depends on the apartment. Where is it located in the building? Does it have a great view of the dumpster, or a great view of the front? You know, I mean, that sort of thing. So typically in regular assisted living, it's rent, room and board. That gets you typically 3 meals a day plus snacks. It gets you, your utilities are not extra. I mean, it covers all of that. It covers 24-hour staffing. It covers activities. Sometimes it covers transportation, not always. And usually that is scheduled transportation, not, oh, can you run me down to the corner store? It's scheduled transportation ordinarily. But it covers all of that sort of stuff. Then you pay for what care you need. Because some people that move into assisted living really don't need care. They just don't want to live alone anymore. You know, they just want to be someplace where they don't have to take care of the house, and they don't want to live alone. And so they move in, and they really don't need any care yet. So then you pay for your care, and there are ways of doing that. It can be levels of care, and it varies what's in each level depending on the company. It can be by points, and you accumulate points, and we charge so much per point depending on what you need. It can be a package. You buy the incontinence package, you buy the medication assistance package, that sort of thing. So it is not at all uncommon to get a response from an assisted living community that will say, well, in order to know what we might charge, we need to do an assessment. That would be absolutely true, because they need to know what kind of services you would need. So they can tell you what their base rates might be. They might be able to tell you what their average resident rate is, so that you get an idea about what kind of the majority of people, or average rates people are paying in their community that cover both room and board and care. But unless they are all-inclusive, most assisted livings that I've had any dealing with, and any of the people that I've worked with or taught, will not give you a good quote over the phone, because they honestly don't know. Now, if they're all-inclusive, they can tell you that, but if they're not, okay? Those are good questions. You got some great ones.
been at this a while.
Yeah.
Skilled nursing,
Mm-hmm.
will that, are there cases where you can't get DNRs honored or found? Or
There should
do
not
they-
be.
Do they send patient to the hospital?
Okay,
and
let's
they
talk
don't
about,
They don't send it with the ambulance, and they can't put their hands on it.
okay, that should never happen. And I know, it should
I'm
never
sorry.
happen
With
in
my
a
mother-
nursing home or an assisted living, or even if you're being cared for at home and the home care provider person is there. Everybody should know if you have a do not resuscitate form. In Texas, anyone over the age of 18 is allowed to complete a do not resuscitate form. Now, I don't recommend it unless you do have some really serious health injuries, issues, or you are really, I mean, I'm old, but I'm not real old, okay? So we've got the old, the frail old, and the very old. I mean, actually, I'm not joking about that. We really do just talk about people that way now. And so I am not very old yet, or I'm not frail old yet, so you need to think about that. Here's the deal. A do not resuscitate form takes effect as soon as it is legally completed. So that means if I'd had one now and I dropped down dead here, and there was a healthcare provider here and they knew that I had a DNR, they wouldn't do that. And I might be resuscitatable, okay? I'm still healthy enough and I don't have any heart issues and, and all that stuff. As we age, the chances of being resuscitated to any kind of quality of life go really down the older you get and the more chronic conditions you get. So at some point, some of us really do need to think about, and we need to have those discussions with our family and everybody in the family, because you will be amazed at how many times, and I'm just being honest with y'all, you will be amazed at how many times the resident has a do not resuscitate form completed legally, it's there, and the daughter is standing at the bedside and saying, do something, you can't just let her die, do something, do something, do something. And now you've got caregivers who are just really in a hard place. So we need to have these conversations with our family and make sure that everybody knows. And one of the things that I would suggest to you, that a friend of mine who's a nurse practitioner suggested to me last spring, and that is record yourself on your smartphone, talking to your daughter, to your husband, to your wife, to whoever, and say, I'm getting to the point now where I do not want to be resuscitated. And you just need to let me go because I'm ready. And so if you record it, sometimes it's easier for the family to accept. You still have to have it in writing, I'll just tell you that. It has to be, and it has to be on, if you're not in the hospital. Oh, I forget about nursing homes. If you're in an assisted living community, you have to use the out of hospital do not resuscitate form issued by the state of Texas. You have to use that form, or it's not valid for the EMS providers. And then also let me say a word about what does that do not resuscitate mean. It does not mean that if you get pneumonia, we are going to let you just drown in your own secretions and die. You're pretty active. If you were in the really, really terminal stage of dementia, that may be the kindest thing that we could do. Okay, but if you're, still relatively active and all that stuff, even though you filled out a DNR, we're not going to let you die like that. If you fall and break a hip, we're not going to let you die in pain. A do not resuscitate really means if your heart stops beating and you stop breathing, what do you want us to do? What I teach in my class is to say to people, if you die, do you want us to try to bring you back? Because that's really what you're talking about. So we need to think about that. Because there comes a point in your life when there's going to be a point in my life when the answer is going to be no. I'm ready to go home. Let me go. And where the information about the DNR is kept varies from community to community. Ask the question. And if my father had a cardiac arrest in your community now and he has a DNR and Susie, caregiver, is in the room, how would she know whether she should start CPR or not? Oh, and by the way, assisted living communities are not required to do CPR. Nursing homes are. Assisted living communities are not. So that will vary from community to community, company to company. Ask the question. They have to tell you that before you move in if you're going to be a resident. But the answer to the question might impact which one you want to move into. If you really want CPR, then you really want to make sure you go to a community that does it. But that's not a requirement in the state of Texas. Okay, so question?
Yeah, you mentioned a state-issued or a state-available form for a DNR, out-of-hospital form. Where are those available? Are they available online?
Yes, they are available online, and I might have a copy that we could run some copies, but they are available on the Health and Human Services website. Type in advanced directives. It's hhsc.state.tx.gov or .tx.state.gov. tx.state.gov. HHSC, Health and Human Services Commission. The doctor has to sign it, always had. But the original ones, that was the doctor's order. It was later changed, and everyone over the age of 18 who's competent can complete a do not resuscitate form. And I will tell you why it's important if you have a loved one in long-term care, because if where they are, the company's policy is to do CPR. Let's say they just have chest pain, but they have a DNR, but they've got chest pain. Well, if they have chest pain, we're going to ship them to the ER because they may be having a heart attack or they may just be having significant dementia angina or something, but you don't keep people in your building if they're having significant chest pain. We send them out for treatment. But if they have a cardiac arrest in the ambulance between your building and the hospital emergency room, if you don't have that state form, they're going to start CPR. Whether you want it or not, they're going to start it because they are legally required to. So that's why the state form is really the only way to go. Okay, and it is available online, and we can help you with that.
I want to throw something in real quick in relation to this. And if some of the questions, do you have any thoughts about how to get people on the same page or help them be in relation to what sort of things to treat? And I mean, it's a family, and then so palliative care along with that, I guess.
And we're going to have a session on palliative care and invite people who provide hospice care. With dementia in particular, this needs to be a discussion, and we need to be talking about this early on in the disease process because end-of-life issues are very significant with dementia. As the disease progresses, of course, what dementia is your brain is dying. I mean, literally your brain is dying. As the disease progresses, toward the end of the disease, there will come a time when the person really does not want to eat, doesn't feel hungry, and really eating is more difficult for the person than it is worth. And then many people are faced with the decision, do we put in a feeding tube? And so you need to talk about that with care providers, wherever you're thinking about, whether it's home and people coming in or in a community. Talk with your family. The bias that I have, and I'm just going to tell you, this is my bias, is that it will not prolong life and it will prolong suffering. And that's just my bias. So if I get dementia, one of my advanced directives is going to be, do not put a feeding tube in. It's not going to prolong my life. It certainly is not going to prolong quality of life. These are the kinds of discussions that we need to have. And I will just share a personal experience with you because this is so important. My father had a stroke at the age of 73, and physically he was pretty much okay, but he wiped out all of his communication ability. And by that, I mean all communication ability. He had no ability to communicate. Verbally, written, match an object to a picture of the object. Looked at you see this in one of Tifa Snow's videos. This literally happened to me. He was staying with us for a period of time, and I put toothpaste on his toothbrush and handed him his toothbrush, and his vision, his brain, saw a hairbrush. I mean, he was that bad. Physically, he could walk around and help dress himself and all that stuff, At one point, though, he fell and broke his hip. And then we had a series of, things that took place. And eventually, he ended up with a septicemia and a blood infection. I was the healthcare power of attorney. I have two sisters. I had a niece who lived in the area, so she was present. And after a discussion with the physicians who said, not responding to the antibiotics, this is not going to get better. And we need to know, and IVs are just, there, but they're not going to really prolong life. We need to know if we need to put in a feeding tube because this is not getting better. And I said, no feeding tube. This is not getting better. He would not want that. He doesn't like the quality of life that he has now. We're not going to do that. It was a difficult decision in that I had to try to explain it to my family who did not understand. It had not been discussed in advance with them. I wish that I had. And I will never forget my lovely little niece just crying. You can't let him starve. And I was trying to explain to her why. So we need to have these discussions in advance because that was probably one of the worst days of my life, having to be there and work on that. So that's another reason you want to bring hospice in early rather than late. It breaks my heart when people get placed on hospice and they die 3 days later or a week later. I mean, really, what was the point? We should be putting people on hospice early on so that their quality of life can be maintained and they can get the support and that the family can get the support. But that should be a discussion with your hospice nurse, yes.
Is that that if you try to force, when they don't eat, they pocket food.
Oh, yeah.
They can choke on it.
Mhm.
They can aspirate. It can go into their lungs, cause pneumonia.
Right.
Their intestines and their stomach can no longer digest because the brain is not telling them to eat.
Mm-hmm.
So it also is not telling them to digest. We've seen people get septic from trying to force food in.
Mhm. It's just a
So
horrible thing.
it's just, yeah, it seems like you're doing a horrible thing, and I've been at a bedside many times, but it is really, your body is already telling you it's not going to do it. The function is done.
Mm-hmm.
And even so, we've had people come in on feeding tubes, and they got severe infections and things from it, because their body was not gonna digest it.
Exactly. We are having a session on that. We don't have any of our new brochures ready yet, do we? We have some of our older brochures down in the corner at the Welcome Center that will give you the date. I just don't remember what it is right now. We are having a session, and again, we will talk about hospice. But we also have a video in our library that Teepa Snow has done, and it's called End of Life Issues, Letting Go. And it helps you understand what the brain is, what's going on with the brain, what it's doing to the body, how to really, it's not giving up, it's letting go. And help us know how to let go. So we do have some resources for you, and we will have a session on that. Because this is a tough decision, but we need to talk about it.
My mom's 99. This is very helpful for me because
Oh, good.
But everyone on her father's side of her family has lived into their 90s, had the dementia, and all of this. And I don't know if it's hereditary, but the fact that I'm 68 makes you go. I don't have kids, and everybody in my family doesn't live in Fort Worth. What do I do for me? I mean, it's all about me here. But, is there...
And you are not alone. Some of you may have heard the term elder orphans. That is a new term now, truly. Their parents have died, there are no siblings, or they have died, there are no children, or they live 6,000 miles away or wherever, and they literally are by themselves. If you are a person who does not have family in your area, or maybe your family's all gone, you'd be surprised how many people move into assisted living and say, I'm the only one of my family left. They have buried their children. I mean, this happens. It's a horrible thing, but it happens. You seriously do need to think about that. So is there a friend, someone that you trust that would follow your instructions? Is there someone in a church? A faith community can be really helpful here. The state has a program that's a guardianship. You're not ready for that. They do have people, though, I believe, that are willing to serve as a responsible person. But really, if I were you, I would try to find a really good friend who would do it. I have a married friend, and she has a friend. She does not have any family member who is her healthcare power of attorney because she doesn't trust her family to do what she wants done. I mean, she just is, she knows that they love her, and she's afraid that they would cave. And so she has her best friend as her healthcare power of attorney to be able to help make decisions for her. So I would really look for a friend or someone in my church, my faith community, maybe a pastor or someone like that.
In addition to the DNR,
You need a healthcare power of
medical-
attorney.
the medical power of attorney.
Medicare or healthcare power of attorney, absolutely. And everyone in this room needs that. Not everybody needs a DNR at this stage of your life, but everybody, regardless of your age, should have a healthcare power of attorney. The younger you are, quite frankly, the more important it is. You think about the cases that have gone to the Supreme Court where some part of the family wanted to stop the feedings and the other part didn't. Those were young people. And young people are more likely than you and I are to be in a wreck that causes a head injury that puts them in a vegetative state.
They have gotten past the point of being able to appoint
Yes.
their own medical attorney, power of attorney, so they don't have one, and the family comes in with no power of attorney, so we can't do anything. They have to apply for guardianship, which is quite an extensive process, and very expensive. sometimes.
Guardianship
So-
is a legal process.
Yes.
So if you know anyone or have anyone in your family that is in early to early mid-stage of dementia, if we looked at Teepa Snow's, gems, they would be before they get to be rubies and maybe before they get to be ambers. You really need to think about helping that person execute a healthcare power of attorney. There are elder law attorneys who are really excellent at that process and helping you with that, and will know. They will be able to assess whether or not your person is really at the stage where they can. We had a speaker here when we did a thing about advanced directives, and her name, and I don't get any, there's no kickback here, but her name was Monica Benson, and she's at a law firm in Southwest Fort Worth, and she is an elder law attorney. There are others. You can call the Area Agency on Aging and ask them for names of elder law attorneys in the area. You want someone who is a member of the National Elder Law Association and is certified nationally. Texas, unfortunately, does not have a specialization in elder law, so you want someone who is part of the national organization. But anyway, this was Monica Benson, Benson, and she did an excellent job talking about it for us, and so I would recommend that. Social workers can also usually have a list of people that they can direct you to in terms of elder law attorneys. Yes.
And also the Alzheimer's Association.
Oh, thank you. You're right. Alzheimer's Association.
They can get you that list, and then you can find it online. They also have the list of folks who are licensed A and B, the forms that you can find on there. The North Central Texas, I happen to have worked for them at one time, by the way. The North Central Texas chapter covers 40 counties. So a 40-county area of every place that type A, type B physicians, geriatric physicians, neurologists who specialize in dementia care, elder attorneys, and assisted livings and long-term care communities, so skilled. And you can get all of that on that website or their 800 number.
And there's a table in the back from the Alzheimer's Association with some of their brochures and things. The Alzheimer's Association is one of the supporters and people that are really engaged with us in dementia-friendly Fort Worth. And they will also have tables here for the 27th when we have our dementia-friendly kickoff, helping people know a little bit more about all the services. If you're dealing with anyone with dementia and you've got questions, you can't find a better resource than the Alzheimer's Association. And quite honestly, our Alzheimer's Association provides some services that not all Alzheimer's associations provide because of a grant. Area Agency on Aging worked with them, and so we have some services that are not available through other Alzheimer's associations. You really ought to call them, and they have a 24-hour call line. So if you wake up in the middle of the night and you can't go back to sleep and you are so stressed and all that kind of stuff, you can pick up the phone and call their 800 number, and you will have a live person to talk to. So they are a tremendous resource for you. They are actually, that's really where I got the name of Monica Benson, was from the Alzheimer's Association. So they're a tremendous resource. Yes. Microphone right there.
Oh, I hate microphones.
Thank you.
If you change doctors or add doctors, as we do, and you had a medical power of attorney with Dr. A, and now you don't go to Dr. A anymore, should you do new directives for
You
a
do not have to do a new healthcare power of attorney. You just need to give him a copy, the new doctor, a copy of it.
Even though it was signed by the...
Oh, that's the DNR. The healthcare power of attorney is not signed by the doctor. That's just your document. The DNR form, even though it was signed by that other person, you should make sure that your new doctor gets a copy of it. And I'd have to go back and look at the instructions on it because nobody's ever asked me that question. That's a very good question. There is an instruction sheet that comes with that, and I will try to look at that and make sure that I am telling you the right answer, and if not, I'll get back with you on that. But certainly if you change doctors, they should get a copy of all of your advance directives. And actually, your hospital that you primarily go to needs a copy of your advance directives. Okay?
I've actually found that the medical power of attorney cannot be invoked until the doctor says it's.
That's right. She's absolutely right. While that DNR takes effect as soon as it's signed, a health care power of attorney does not take effect until the physician says the person who executed the health care power of attorney lacks the capacity to make health care decisions. And that is a huge distinction, especially for providers. I will tell you that daughters walk in all the time to assisted living communities and say, I'm my mother's health care power of attorney, and they expect to sign everything and make every decision, and mom is as lucid and with it as you and I are. And daughter cannot sign in place of her mother anything. She can sign with her mother if her mother wants her to. But if you're the healthcare power of attorney and you're the person that you are the healthcare power of attorney for is still competent, has the capacity to make their own decisions, you have no decision-making ability at this time. Okay? For example, my husband is my healthcare power of attorney. Do you think I let him make my healthcare decisions right now? The answer to that would be no. Okay? He makes his own decisions. Now, if he loses the ability to make decisions, then I can step in and make those. And I will tell you that not all physicians know that. When my mother-in-law had this reversible dementia, and then I'll shut up because it's 1 o'clock. When my mother-in-law had this reversible dementia, when I found out what was going on with her, I went with her to see her doctor. And I said to him, I was her healthcare power of attorney, I need you to please put something in writing that indicates that she doesn't have the ability to make decisions right now, and I can make decisions for her. And he said, you don't need that. And I said, yes, sir, I do. And he said, well, I don't understand why you need that. And I said, because she can't make decisions, and I'm her healthcare power of attorney. And I need you to put that in writing, that she can't make decisions. And he finally turned to his medical assistant, and this is the honest truth. Whatever it is that she says, put it in writing and I'll sign it. So don't expect all of your physicians to be really wise about this. And don't expect all the providers of health care to, in residential care and in-home care to be really wise about this, because some of them are just, I have to talk about this in every class that I teach for the Assisted Living Association, because people are still letting daughter sign when mom is still with it, okay? But you make a very good point. Please talk about this while your person is still able to talk about it. Because once they get to the point where they really can't make that decision anymore, then you have to go the guardianship route, and that is an expensive route, and it means going to court. You've got to have an attorney. I mean, unless you go through Guardianship Services of Texas, which is a state agency. But, I mean, it's a drawn-out process. And then you have to go back to court every year. So, I mean, it's a mess. Yes?
One more thing. I read the best book. I think it's called Having the Conversation. And it's written by a doctor, a young doctor up north, and they actually have a video that they show patients that need to have the conversation with the family. It's a short, small book. It's great.
That's fantastic. Careconversations.org, I think is what the website is. I'll look it up to be sure. And then that elderindustry.org or .com, whatever it was that I told you about a while ago. I've got it written down here. They have some great resources on there, including a book, including some forms that you can actually, just click and use for the conversations and all that kind of stuff. So there are lots of resources. If that's something that you're really looking for, let us know. We'll be glad to try to help. Now, I'm going to stop and let you have some time to visit with the folks that are here and ask some more questions specific that you might need some help with. Again, we want to thank them for coming. I want to thank you for coming, remind you of Dementia Friendly, Saturday, January 27th, 9 o'clock in this room.
And Linda, I want to thank you. We are so fortunate to have you here. What a wealth of knowledge, and all of you for contributing.
We're blessed to be able to do this. So take some time and visit with our folks that are here. We're repeating this session at 5:30 this evening. If you know someone that this might benefit, we're going to do the exact same thing this afternoon at 5:30. So let them know.